Hello and welcome to How to Breathe for COVID-19 Part 2 Treatment. My name is Danny May and this is a 3-part video series offered through Breath Guidance. If you have yet to already watch Part 1 for prevention and preparation, be sure to watch that now. And after this video, be sure to watch Part 3 for recovery. So this video is all about allowing yourself to find relief from the symptoms of COVID-19. A lot of people are saying that they feel breathless, they feel short of breath, it's hard to breathe, they're finding that they have coughing. A lot of people are reporting all different types of symptoms, so know that these breathing techniques may or may not serve you the best, and it's always important that you consult your physician before taking on any types of treatments or practices. So the first technique is really easy and accessible for most individuals. What you'll be doing is laying in a prone position. That means you're going to be laying flat on your stomach. And as you're laying flat on your stomach, you're going to do a 3-part breath known as a dirga. And the idea behind this is that as you are laying on your stomach, 40% of your lung volume is more towards the front of your body and 60% is more towards the back. So especially if you've been laying in a hospital bed, if you have like a moderate case and you're building up fluid in the lungs, you want to allow your body to flip over. And this way we can not only have more tangibility to how you're feeling the breathing mechanics, the muscles you're using to respire, but also to really access that back 60% of your lungs and even drain out some stuff that might be in there. So you'll lay down flat on your stomach and you want to make sure that your elbows are above your ribs. So that means that you may take what's known as a goalpost position. My personal favorite is interlacing the fingers, bringing them underneath my chin, and then just allowing myself to lay on my belly like that. You might even allow your arms to be up and over your head, but if you can, try to make sure the elbows are at least a little bit above the ribs to stretch some more space. Then you're going to be breathing in 3 parts. First into your low back. And if you have someone who's around you, maybe even have them place a hand there to feel that they're getting some tangibility, that you're really allowing that part of your body to move. And then you're going to breathe into your middle back, and then you're going to breathe into your upper back. When you exhale, you're going to pull your belly button in so you can deflate your low back first. Then you're going to squeeze your ribs in towards your midline so you can deflate your middle body. And then you're going to allow the upper body to really start to come together so you can deflate the upper body. And even though your lungs don't go all the way down to your low back, what we're working with is your primary breathing mechanic, your thoracic diaphragm. We're also working with the elasticity of your back muscles, your abdominal muscles, a lot of other accessory breathing mechanics. So the idea is to really feel as much feedback as you can when you take that first sip of air in, and you want to allow your belly to really push into the floor or the bed or whatever it is that you're laying on so that you can feel your low back really start to rise. And then you do the same thing with your middle portion, and then you do the same thing with the upper portion. And think of not just going up and down, also going side to side. So really breathing in low back, middle back, upper back, exhaling from low back, maybe even lifting your belly up and off the earth or the bed, whatever it is you're laying on, really emptying out through your middle body and really emptying out through your upper body. So that's a pretty easy and accessible technique that you might find a lot of benefits for and a lot more space and comfort and ease with your respirations. All right, so the second technique is a little more intense and will have a lot more effect. So be mindful if, again, these breathing techniques feel like they're not serving you, just don't do them. Simply breathe in and out through the nose and allow that to be your breath work, where you're just trying to get the air in, trying to get the air out. With this last technique, if you have glaucoma, if you have any cardiac issues, if you have any neurological issues, if you are pregnant, there's a lot of things going on that you want to be careful with this last breathing technique. So please make sure to try this first variation first, besides this last variation. So the first variation is going to be a little bit easier. What we're trying to do is stimulate the lungs. Again, if there's any fluid or buildup, we want to allow that to come out. So you're going to be doing a little bit of tapping as you breathe in. And this you're doing seated. And if you have someone with you, it's really beneficial to have them tap on the back of your body as you breathe in. And they can start at the lower part of your lungs. They can start to tap towards the middle lungs, tap towards the upper lungs. And thinking of, I don't know if you can hear it in my voice, but like a tapping that's hard enough that you're going to get some benefits, but it's not too hard that you're hurting yourself, and it's not too soft that nothing too much is going to happen. So first variation of this last technique is the easier one. So if you have certain contraindications like glaucoma, diabetes, pregnancy, neurological, cardiac issues, you can do this variation. Just be very mindful with it. You're tapping as you breathe in. You're then just going to pause your breath for a moment. And then you're going to do what's known as a cleanse. You're going to use it from your nose, kind of like you're trying to blow your nose. And then at the very bottom of that, you're going to do a little cough. Inhaling, tapping. Pausing the breath for just a moment, less than 5 seconds. Cleansing from the nose. And then a cough. So that's a easier variation of this technique. If you are otherwise pretty healthy, you don't have any of the contraindications I listed, or any ones that your physician says this might not work for you, then you can do this other technique. And this is the full expression of it. So if you can, you're tapping on your chest, somebody else is tapping on the back, you're taking a really strong deep breath in. You're gonna hold your breath here, and as you hold your breath here, this is called a hook breath. So you are bearing a little bit of pressure, and instead of thinking bearing up or bearing down, like, you know, if you have to go to the bathroom, you kind of bear down. In other breathing techniques, you would bear up. I want you to think of bearing forward and backwards. So as you're holding your breath, bearing forwards and backwards. This is where you have to be really careful, because this is the main contraindication that can cause a lot of people different issues. So please don't do this breathing technique if you have any contraindications whatsoever. But again, it can be really beneficial. It creates more pressure into the lungs. And then instead of clearing from the nose, you're going to clear from the mouth and a harder cough. So to repeat, inhaling, tapping, maybe someone's tapping on your back too. Hold the breath in, bear forwards, bear backwards. And that will bring you a lot of space. You probably might be coughing stuff up. Again, I really want to stress that you be mindful with these breathing techniques. I know a lot of times people think like, oh, it's just breathing, but your respiration and the respiration patterns and techniques can really bring a lot of different benefits through your hormone secretions, your neuropeptides, all throughout the blood chemistry, and just the way you're creating pressure inside the body. So be mindful, be careful. If you have any questions whatsoever, please pop them in the comments below. I will do my best to answer them appropriately. And if you're interested in learning more about breathing and breathing techniques, please check out breathguidance.com. We run a breath technique training a few times a year where you can learn 60 breathing techniques in 6 weeks. We also have a virtual membership where you can get full access to an entire library of breathing classes with 15 different styles, and we do live classes, pre-recorded classes, live Q&As. We're definitely really passionate about the breath, so please check us out. If you like this video, hit the like button. If you really enjoy this video, please hit the subscribe button. And don't forget to share these videos with people who you think would benefit from them. Again, I'm Danny May. This video is from Breath Guidance, and I sincerely appreciate you breathing with me. I hope to breathe with you again soon.